we are going to quickly walk through autism, catatonia, and some conditions that are related to both autism and catatonia. And the point is going to be for us to better understand all of these terms so that we don't mix them up, because it's so easy to mix them up all the time. All right, so the first one is called regression. I'm going to define it in a minute. Burnout is another one. Catatonia is one. Depression is one. PTSD is one. So these are all conditions that autistic people may be dealing with, right, at different points. And some of them seem really similar. For instance, what is the difference between burnout and catatonia? What is the relationship between regression and burnout? We're going to discuss this. And then I've also included a sixth, schizophrenia, which is sometimes found with autism, not nearly so commonly. But I was asked a question about autism and schizophrenia by someone who has both conditions, and so I thought I would include it on this list. Okay, so you'll see that the first two of these just turned blue, which matches the color of my shirt today. Throughout this presentation, I'm going to be using the color blue to identify language that gets used a lot in the autistic community and may not be used as commonly by doctors. So a great example of this is the second word here, burnout. Autistic people talk about being burnout all the time, and we often know among ourselves what that word means and how we're using it. But if you were to open up a guidebook of disorders that was written for doctors, you wouldn't find it in there. There's a very famous book that catalogs all mental health disorders, which is the authority used by psychiatrists in diagnosing people and filing for insurance. And it's called the DSM. And the DSM says nothing about autistic burnout as a specific condition. This is our language, and I have kept my shirt blue today because I am an autistic person, but I'm not a doctor. So you can see that connection. And we're going to talk a little bit more about how that can impact the meaning of the words and how it creates overlap, because as you probably know, different communities often have different words for the same thing. And sometimes that's what we see, especially when we're looking at burnout and some of these other problems, right? We might say burnout when a doctor might say mild catatonia, depending on the situation. Okay, so as we move on here, these next four are green because they all relate to the medical community. And I thought green, which sometimes means health and healing, was a good color to associate with doctors. These things are all in that book I mentioned, the DSM. They're all clinically studied disorders, and you can expect to be well understood if you ask a doctor about them, even if a doctor who doesn't specialize in autism might not know exactly what you mean by burnout. They're going to know what you mean if you're talking about PTSD. Okay, so we're going to keep that distinction in mind, the fact that we have two sets of words which are used by different communities to different ends as we move through some of this language. So the first word we're going to look at is regression. When people or things regress, they go backwards, right? Progress is going forwards and regression is going backwards. Normally, when people talk about autistic regression, they're referring to skills and especially language. So if you start to lose the language that you developed as you grew up, that's a case of regression. As you'll see, though, in the clinical literature, right, this comes from a medical journal, there is no universally agreed upon definition of autistic regression, but the definitions that do come up tend to focus on this idea of a previously attained skill, which has been lost. So you'll see regression is sometimes talked about by doctors. This is a journal for doctors, but it's not clearly defined and studied by doctors in the way that a condition like catatonia is, right? Catatonia has a clear definition. Doctors teach other doctors how to recognize and define it. And it's pretty clear cut at this point what counts as catatonia and what doesn't count as catatonia, even when it's hard to spot. But autistic regression is still a little bit looser. At the same time, in the autistic community, we usually know exactly what this term means. It means that we feel like we're moving backwards a little bit. Maybe we feel like we're becoming quote unquote more autistic. That's a term that some people use as they go through burnout or catatonia. That's not clinically possible to become more autistic, but it's a phrase that we use in our community to convey our experience. Burnout is another one of these examples of a term that is very clearly understood in our community and often not understood outside it at all. This is one definition I found by Dr. Dora Raymaker, whose article is available at this website. Dr. Raymaker also published an article on autistic burnout, which was the first formal academic study of burnout that I've seen. And I think it was the first one published. So she's beginning to bring this syndrome, as she calls it, this experience, to the attention of doctors. And she's helping the medical community understand more what we mean when we talk about it. That's something that she points out in her work, is that we do have a shared sense of what burnout means. And she has define the term through these characteristics: pervasive long-term exhaustion, loss of function, and reduced tolerance to stimulation, like noise, for instance. And she points out these is typically caused by life stress, by a mismatch of the external expectations you're facing and your abilities, and by not having adequate support. So to move to the next slide, I know this is a little bit of a cheesy graphic. I hope you'll bear with me, but I thought it might make some of these ideas more memorable if I attach some pictures to them. You know, you see in all these pictures, there's a sense that people just have way, way, way too much going on. This person is being buried in paperwork and phone calls. This person feels like their battery is down to 1%, right? This person has collapsed because they can't handle the volume of work that's coming at them. This person is kind of dazed and asleep in a chair. And this person down here is withdrawn. So we don't actually know what's going on with this person, right? Someone who's just withdrawn like this could be having a lot of different experiences. I've included this graphic here to show that we can become super withdrawn just because we feel like this. We feel like everything around us is piling up. We feel like all these expectations are making us dazed and overwhelmed. We may feel like we can't face all of the studying that we need to do, or all of our bills or our other obligations. This is what burnout looks like. And again, I've made it blue because it's usually our term. The first question that pops up might be, could burnout and regression overlap? Yes, they absolutely can. Regression can be a symptom of burnout. So, for instance, if you are feeling that sense of overwhelm and you're slowing down, you're struggling, you're getting upset more often, you're becoming withdrawn because the expectations around you are too much and you don't have enough support, that's burnout. Well, what if at the same time you were losing skills because of those things? You weren't able to talk as clearly. You were losing some kind of other skills that you gained as you grew up. Then you could be experiencing both regression and burnout at the same time. And the burnout could actually be causing the regression. Okay, so the next one is catatonia. And here you see our color changes to green. That's the suggestion that doctors know about catatonia. They study it. It's their language, and it often shows up in published medical research and in that DSM and in other books written by doctors about patients. So catatonia leads to impaired communication. It leads to strange movements or lack of movement, and what's called behavior abnormality. I made a long video about catatonia recently, which goes into a lot more detail, but for now, I'm just going to look at this set of images that I put together. Some of these are stock photos, that is, pictures I found on the internet, but some of these are actually medical pictures of people experiencing catatonia. So this person here, who's kind of frozen in an odd position in bed, is catatonic. And you can see she's almost like a statue. It's almost like somebody hit her with a wand in a movie, right? And she just had to stay still. That's a really common feature of catatonia, especially more advanced catatonia for us, right? It's not always seen in autistic people who are catatonic, but it's a common occurrence. And then this is another picture of a real person with catatonia. And you can see they have their head tilted up a little bit, right? You can't tell because it's a picture and not a video, but this person is actually frozen in space like that. He's being very stiff. That's actually called a psychological pillow that posture because it looks like he has a pillow there, but in fact, that's just how he's holding his head. Now, not all autistic people get frozen in postures like this when they're catatonic, as I've said, but there's a kind of feeling of frozenness that often comes up, even if it's more emotional or social and not physical. So sometimes people with catatonia can be quite withdrawn, right? They're non-responsive. They don't answer people's questions in the same way. Sometimes we grimace when we try to smile. We might make a facial expression that's almost right, but not quite, because our facial muscles are a little bit unresponsive. And we might just feel socially awkward and unable to connect with people in new ways. When I was catatonic, I had this sense of kind of being unable to move my face and unconnected from my physical body and my physical experience, right? So I included this picture. I just happened to come across it, but I thought, yeah, that is a sort of metaphor of how it felt. I felt like I was fading away a little bit at that point. And sometimes I also felt like I was trapped, although of course no one tied me up. I sometimes felt like I couldn't move. And here I've included the same picture that I had above in our picture of Burnout, which is a young woman sitting by herself. And I kept the picture the same just to show that sometimes catatonia and depression can look the same from the outside, because withdrawal is a symptom of both of those things. But you can see that in other ways, these two disorders are quite different. So here's our question. Could burnout, which is our autistic term, and catatonia, which is a medical term, overlap? Yes, they could, and they often do. In fact, sometimes they're two words for the same thing. It's just that they are two words that were created by different communities. That's not always the case. Catatonia is a serious medical condition that can have a lot of major risks. Burnout isn't always that, but it can be. And sometimes when we use the word burnout, it sounds casual. It sounds like something that everybody experiences. It sounds like being tired at work. And the very casualness of the word can hide the fact that burnout can be medically dangerous. So it's important to look at some of these overlap and see when they're actually referring to the same condition. So just for the purpose of further clarity, I made a comparison chart. Is it a medically recognized disorder? Burnout is not. Catatonia is. Can it lead to a loss of speech, which is an example of regression? Yep, both can. Both of these things can lead to withdrawal or shutdown. They can lead to more meltdowns. They can lead to eating problems. They can lead us to feeling stuck. But only catatonia will lead you to kind of freeze like a statue or start to become frozen like that. Now, if your burnout is becoming catatonic, you may have that experience of frozenness, right? But that's because of the catatonia. Now we have depression, and it often involves really negative feelings, sadness, being irritable or in other bad moods, loss of interest, trouble doing normal day-to-day activities, feeling that everything around you is pointless. When we talk about depression, we often call to mind images of crying or sadness or grief. And not everybody who's depressed is sad or even having really strong emotions at all. Sometimes people who are depressed have no feelings, but in those cases, they normally also have a sense that life is pointless and that life offers them no real pleasure. They might feel a kind of despair. Okay, so here again, this is another cheesy collage, and I hope you will bear with me as someone who has been depressed. I am not trying to make light of depression. I just want to show you these sort of mnemonic images to give you a sense of how depression differs from some of what we've seen. So again, I kept the same picture because depression can look to the outside world like simple withdrawal, especially in autistic people. But it typically involves much stronger feelings and much stronger negative feelings than catatonia does. When I was catatonic, I was not especially depressed, but then I've been depressed and not catatonic. And in those cases, I might look kind of the same. I might just be protecting myself or hiding myself from sensory stimulation or whatever, but I feel as if there's a cloud above me somehow. And even if I'm not sad, I might have a general sense that there's no hope at a particular moment in my life. So it's just a sense of really negative feelings and a really negative reaction to your environment. Catatonia is more about not having a reaction to your environment, right? So in both cases, you might be really unmotivated or unable to do things. Both depressed people and catatonic people sometimes have a hard time getting out of bed, for instance. hard time going about their day, but the root causes are different. Now, that said, sometimes depression and catatonia can overlap, but that usually only happens when depression is very severe. So, this is, if you look at this image, you get the sense of someone who's really pretty tuned into the world. They're having a lot of reactions to what's happening around them, even if those reactions are negative, even if those reactions are hopeless, right? And even if the reaction is to back away from the environment. But if we go back up to this image here, catatonia, this is someone who's really become non-responsive and frozen in their reactions in a really different way. So you could imagine that if someone was really severely depressed, over time, they might arrive at this super withdrawn kind of frozen state. And sometimes we do see that happens, but it's unusual. Okay, so let's just quickly go through this comparison chart. Depression and catatonia, are they medically recognized disorders? Yes, they both are, right? They're both discussed in detail in that DSM manual. Can they lead to withdrawal or shutdown in autistic people? Yes, they can. Like that picture that we saw of that young woman who was kind of hiding and had her face down. Can they lead to meltdowns? Yes, depression and catatonia can both lead to meltdowns and can lead to eating problems, okay? Depression can make you feel horribly sad, and catatonia doesn't, right? Unless you are depressed at the same time that you're catatonic. Does it make you feel hopeless or despairing? Depression absolutely can. Catatonia doesn't. Can it lead you to freeze like a statue? Depression does not, although catatonia absolutely can. Of course, there are times where someone might be dealing with some catatonia and they might be depressed. And then we might see some of these symptoms presenting at the same time. But this gives you a sense of how the different disorders might be involved in producing some of these effects. Then the next one is PTSD, which is really common for autistic. If something happens that's really stressful to you or really terrifying, then you might end up having flashbacks or nightmares or severe anxiety, uncontrollable thoughts about the event. This definition, I'm sorry, I need to fix this. So I left the citation for depression here. It's actually from a Mayo Clinic article about PTSD. So the broad source is right here, but the link is not correct, and I can fix that. So I would say at an even more general level, the identifying feature of PTSD is a difficulty leaving the past in the past. If something terrible happened to you, and then 2 weeks later you think, oh, wow, that terrible thing happened to me last Wednesday. I saw a terrible car accident or whatever. That's such a bad memory. I'm sad about that still. That's not PTSD. PTSD is if 2 weeks later you walk outside and you see a car turning in the intersection and all of a sudden you feel like you're right back at that moment of that accident. You have the same kind of adrenaline, you have the same kind of emotions, and there's something going on in your mind that makes the past and present kind of bleed together and seem like the same moment, okay? So that's sort of a subjective definition rather than a clinical definition, but treatment for PTSD is often about helping your brain recognize the difference between past and present. Okay, could PTSD and catatonia overlap? Yes, absolutely, okay? Severe PTSD can lead to catatonia in some people, although it's unusual, but PTSD is actually a fairly common cause of catatonia. And then this last is schizophrenia. Schizophrenia is a serious disorder. My deep empathy for anyone out there who's dealing with this, because I'm sure that it's just a lot to handle on the regular. So people who have schizophrenia may deal with hallucinations, which are pictures or smells or sounds that turn out not to be real. They might have false beliefs about the world. They might think in a kind of disorderly way, and they may have a really hard time distinguishing between what's real and what's not, okay? Could schizophrenia and catatonia overlap? Yes. In fact, scientists used to think that all catatonia was caused by schizophrenia. So if you were catatonic, you must also be schizophrenic. So I included that mention of schizophrenia because somebody who was both autistic and schizophrenic asked me a question, and I thought I'd include it here. They said, if I have both of these conditions, which one is causing the catatonia? right? And I said, of course, as with everything, the answer is to ask a doctor. And that's especially true for everything in green, right? Those are medical problems, therefore they have medical answers. It might be, though, that the doctor isn't sure. And I say that because I read a bunch of medical literature in order to try to answer this question. And it seems like scientific researchers are still figuring out whether the term autistic catatonia and the experience of autistic catatonia just means catatonia experienced by autistic people, or whether it refers to a really specific subtype of catatonia that's caused by autism. So to give you a more detailed example of that, it could be that autism doesn't actually produce catatonia. It's just that autistic people sometimes get catatonia for other reasons, like maybe they were traumatized, or maybe they were depressed, or maybe they have schizophrenia, or maybe they have a kind of brain infection or something which could cause catatonia. And then when they get catatonic, it looks a little different than catatonia does in other people. Or it could be that the autism is actually producing the catatonia in some ways. You can see how those two scenarios would be really difficult to distinguish purely from observation, right? And as a result, there's still some question in the medical research community about which of those scenarios is actually happening. But the good news, as I put down here, is that catatonia can be diagnosed and treated by psychiatrists, regardless of which of those scenarios is happening, regardless of what the root cause was. So for now, it's all right if we don't fully understand the origin of the disorder, because the treatment is available to us, right? Which is great. So now all of the rest of these questions that I've included here are only about what kind of doctor or other medical specialists you might want to find in order to help you with these conditions. So what if you're experiencing autistic regression? In that case, you will probably want to talk to a psychologist specializing in autism. You can find that person, if you don't have one, by going to the Psychology Today website and going to their database to find a psychologist. And they should have a filter, which enables you to filter psychologists by specialty. And you can find people who specialize in autism that way, okay? You should also talk to your primary doctor. In the US, that person is sometimes called a general practitioner. In Canada, it's called a family doctor, but they're two words for the same thing, which is the doctor in charge of your overall health. You might want to talk to a speech and language pathologist, also known as an SLP, who could help you if you were losing speech, and who might be able to teach you other ways to communicate and also help your family adjust to your new way of communicating. So if you're experiencing a regression and you end up needing to use a talker, as we call it, an iPad or another device that talks for you, an SLP could help you make that transition and maybe teach you to use it and also talk to your family about it. And many people find that very helpful. You could also talk to an occupational therapist who can help you cope with your environment, give you some good advice about changes that you could make and how you deal with the things around you, maybe even organizing differently, right? Or redesign your environment to be more accommodating for you. So they can help you figure out if you're losing motor skills, for instance, what can we do to help you get ready in the morning or prepare food or do all these other things, even though you don't have the same skills that you did. So a whole team of all these people could really help you get better or adjust to your new circumstances. Or it may be that just one or two of them, for instance, just the psychologist, could help you get on the path that you want to be on. You might start with a psychologist and the family doctor, though, because those people might be able to give you referrals to the other people. Okay, what about autistic burnout? What kind of doctor should I see? You should go see a psychologist specializing in autism. You might want to talk to all the people that you might talk about autistic regression. If you are taking medications, though, you should also talk to a psychiatrist, who is a kind of doctor that specializes in mental health and medication, because in some cases, burnout can be made worse by medication if the side effects of your medication are sedative in any way. If they have some kind of deadening effect on your mood, they might be a culprit in your burnout. So you might want to talk to your psychiatrist and get all your medications reviewed. Okay, and if you think you might be in burnout and also dealing with catatonia, we should look at this slide. What kind of medical specialist can help me with autistic catatonia? You should talk to a psychiatrist. Psychologists also sometimes know a lot about catatonia, so that's a good idea too. But a psychiatrist is really the person who's most important to see because autistic catatonia can be a dangerous medical condition, and a psychiatrist has a doctor's degree. They have an MD. They've been through a lot of medical training. They've typically done a rotation, which is a kind of training in a hospital. So they may have seen catatonia before, and they will also probably have a network to help you if your catatonia is becoming dangerous. You might have to find a psychiatrist if you don't already have one, but that same Psychology Today website will help you out, and your doctor might be able to give you a referral. If you go talk to a psychologist, as you should, you want to find someone who specializes in autism, and ideally someone who has at least some other patients who share your level. So if you are level 2 and you find a psychologist who seems good and says they're an autism specialist, go ahead and ask them, are all of your clients level 1, or do you work with people who are level 2 or 3? Because you don't really want to be the only person at your level dealing with your psychologist. Your psychologist just isn't going to have enough experience to help you. So if you say, what level are most of your patients? And the psychologist says, oh, they're all level 1. You should keep looking, even though they're probably a great psychologist, they just might not be a fit for you. And then this part is important. If you are experiencing shortness of breath or serious difficulty moving, you need to go to the ER, to the emergency room, okay? It's possible for someone in catatonia to have their nervous system totally shut down to such an extent that they can't breathe anymore. That is extremely, extremely rare, and it doesn't typically happen out of the blue. But if you feel like your breath is getting really dysregulated, there's no point taking a risk, right? You just need to go get checked out and helped. What about depression? This is more open-ended. Lots of people can help you with depression because there are lots of different treatments out there for depression that work well for different people. So again, psychologists are going to be a classic first place to look. A lot of psychology that is designed to help people with depression involves talking and processing feelings and experiences. For some people, that's a problem because they may not be able to talk, especially if they're already in regression or if they're already catatonic. So if that's you, but you feel like you would be helped by pursuing these kinds of therapies for depression, you can ask if your psychologist will talk to you via chat. And some psychologists are very happy to treat patients this way. This is something that you can ask ahead before you've even booked a session with the psychologist. And if your current psychologist isn't willing to do treatment that way, you can go to that Psychology Today database and find someone who will accommodate your disabilities so that you can get the kind of treatment that you need. Psychiatrists can help you with antidepressant medications, and sometimes even your primary care physician, whatever it's called in your country, can help you with antidepressants. Okay. Psychiatrists are often a little bit more skilled at trying different meds or getting you on the correct dose because it's their specialty. It's the only thing they do, but that doesn't mean they're the only people who can help you. And of course, if you're worried about self-harm or self-injurious behavior due to your depression, you should go to the ER just to protect your safety. What kind of medical specialist can help me with schizophrenia? I actually don't know a lot about schizophrenia, but I feel pretty confident that you need to talk to a psychiatrist who specializes in schizophrenia. You might be able to get some medications that will help you a lot. Your primary care physician might be able to refer you to a good psychiatrist. And I also happen to know from reading that some people with schizophrenia are greatly helped by having a service dog who can help them distinguish hallucination from reality. For instance, if they see a person in the room all of a sudden and they don't know if the person is really there, they can ask their service dog to greet the person. And if the service dog doesn't do anything, then they know the person is a hallucination. So I imagine that's very helpful and reassuring for people with schizophrenia. Service dogs are obviously a process, right? You can't just go to the corner store and pick one up. You have to be approved, and there's often a wait list, but they are available. So that's exciting. And I'm sure that if you're looking for a doctor to help you with schizophrenia, you want someone board certified in psychiatry. You want someone who has an MD. You don't just want someone who's a really good family therapist, but who doesn't know anything about serious disorders. I'm sure that if you go talk to your family doctor, they will be able to send you in the right direction, which will be better than listening to me on the internet, because I am not an expert. I just wanted to include this here for the sake of completion.